Hi there, and welcome to the Unleashed This podcast presented by Unleashed Technologies. We're glad you're here today. My name is Dustin Hickle. I'm the marketing director here at Unleashed, and I'll be hosting this episode. The title of today's episode is How to Improve the Patient Experience Using Your Healthcare System's Website. And to help us talk about that and learn about that today, we actually have two guests instead of just one, Caroline and Garrett. Why don't you guys both take a minute here and introduce yourselves. Tell us what you do at Unleashed. Give us a little bit of your healthcare background before we dive into the questions. Caroline, you want to go ahead and go first?
Sure. Hey, everyone. I'm Caroline Bennick. I am the Director of Digital Strategy here at Unleashed. Typically, that means that I lead the strategy and the creative teams through all the different phases from discovery, which is understanding what your goals are, strategy, which is how can we achieve that goal, the IA, the wireframes, the designs and the requirements and the like. I have been involved with building healthcare websites for about 10 years now. And yeah, excited to chat a little more.
And hey, everyone, I'm Vince. I'm a senior project manager here at Unleashed, been with Unleashed about a year. My role is kind of a hybrid role, so I work with our entire client base for project management, and then also I work with analytics and data on Caroline's team as well, so help all of our clients with any of their data needs, data visualization, and that kind of thing with websites. Prior to coming to Unleashed, I worked for a large academic healthcare institution where I managed a multitude of their websites for them, looked at all aspects digital, be it social media, integrations with Salesforce and the electronic medical record, and obviously they're public facing websites.
Awesome. Yeah. I'm really excited for you guys to be able to share your experience here with the people who watch this. I'm just going to jump right into question one and let you guys share your knowledge here. Let's just jump right into the first question. You've both been in the healthcare space for many years. And I know the term digital is kind of broad and can mean a lot of different things. But in your opinion, what is one significant digital pitfall that you see healthcare systems fall into that can negatively impact their patients' experience on the website or across their various digital platforms?
Yeah, I have a couple actually that come to mind. One thing that, working with so many healthcare systems that I've noticed is that a lot of them are gearing their content towards, condition research center when, we all know that someone's going to go to like Mayo Clinic or WebMD or something like that for that type of information instead of tailoring their content about their conditions and treatments as to, yes, this is what this condition is and what you can expect, but here's why you should choose us. So why should someone choose you for a cancer treatment center over, the next town over cancer treatment center? They probably by that point know what their condition is, but why should they choose you? So we often find that, they need to kind of swap their content out of this is what this is, but why should you pick us? I mean, you can add things like, your awards, your U.S. News, World and Reports, how they help the community, things like that. There's so many differentiators that hospitals and healthcare systems could be using to distinguish themselves versus trying to become, the next Mayo Clinic or WebMD or whatever it is. So that's, I would say, is one thing. Another thing that we're seeing a lot is, in today's society, everyone kind of wants something right now. And, even myself, when you're not able to schedule an appointment online or something like that, it's kind of frustrating. You don't even want to pick up the phone and you don't want to, have to email somebody. And I want to know when my appointment's going to be now. And that's just kind of the way that we as a society have gotten used to with the advancements of technology. So not offering something like scheduling an appointment online that could potentially drive a patient away to look elsewhere just for that convenience factor. So providing all those options, which, There's things like video visits and things like that that are gonna make a patient say, "Hey, this is easy. I can get immediate gratification." Well, I can I can know exactly when I'm signing up for an appointment and not have to wait around, submit a form, call in. It's just kind of the way things are, moving these days. So I would say those are at least two things. I mean, I could probably go on forever, but I would say those are two that come immediately to mind. What about you, Garrett?
Yeah, I think you hit the two major ones for sure. From a content standpoint, I think everybody, tries to follow in the footsteps of the Mayo clinics and the Cleveland clinics and try to have these huge, daunting websites of pages upon pages of content. So I think you hit the nail on the head. At the end of the day, we need to have our competitive differentiators. We have to, explain to our patients why, your organization is the right choice for them and their condition. The providers that you have on staff, why they're the best at what they do. And then I think the other aspect that I would think of is more on the technology side. I think a lot of healthcare organizations, as they're designing their websites, in the industry, we spend a lot of our time on a laptop, on a desktop computer, and oftentimes we overlook the fact that a lot of our business, the majority of our business, in some cases, are going to be on a mobile device, be it an iPhone, an Android, an iPad, and designing your website or your web applications with that in mind is huge for the user experience that the patient's interaction with your website's going to be. I know my work with healthcare organizations, when we look at the data and analytics side of things, oftentimes we see mobile traffic to these websites over 50%, in a lot of cases over 60%. So it's a huge aspect that we have to consider when we're building web apps and websites for a healthcare organization.
Yeah, I think that makes total sense. You guys both kind of, um, well, the next question is about the consumerization of healthcare. So we're kind of going right down that path, and I'll keep us there. But you guys are hitting it right on the head, right? People want to know, can I schedule an appointment now? They want to know, can you help me? And they want to know, like, is it going to be easy on my phone, right? That's all of us. It's basically, Amazon and every other e-commerce platform online has kind of spoiled us to where we expect that from even our healthcare providers now. And I think people who are falling behind, obviously, well, they're falling behind. But with that same kind of vein of thinking, right, the consumerization of healthcare overall, um, surely we have some recommendations, some tools that we're kind of presenting to healthcare organizations to help them improve access to care, help them improve those patient engagement scores with that consumerization in mind, right? Maybe share a couple examples of those.
Yeah, absolutely. I can jump into this one. Yeah, and you kind of nailed it in the question. It's all about access to care. It's how well is the patient's initial feedback or initial interaction with your website? How easy is it? How easy it is it to find the information that they're looking for? Whether that's finding a location that's near them for starters. Is that location open at whatever time of day or night they're looking for care? And that kind of plays into not so much a web vendor, but the tools that can be utilized to kind of aid in that. And as we look at healthcare organizations, from large to small, a lot of them have a multitude of locations, a ton of different healthcare providers, and being able to have kind of a single source of truth to manage all of those different assets for an organization is huge. And I know, we as an agency partner with a lot of different outside vendors, folks like Press Caney and Yext, that are really the experts in that location and kind of provider management space. They can be huge to be able to have one source of truth, one system to be able to go into. If we've got July 4th, coming up as our holiday, if you're going to have closed locations, altered business hours, some providers may be taken off and their office may be closed and unavailable for scheduling. Being able to go into one system and update all of that information and have it cascade across the internet, be it your own website that you own, be it your Google My Business listings, your Bing search listings, social media. I mean, it's endless as far as the number of digital locations that are out there for a healthcare organization. So having that one source of truth, being able to quickly and efficiently be able to update that information And, at the end of the day, it's all about accuracy of information. The last thing we want to do is 9 p.m., little Johnny breaks his arm and they're looking for an urgent care at an emergency room that's going to be open. And, we definitely don't want to send them in their time of need to a location that's closed, has different business hours, because then that's going to be a very, very poor patient experience for sure on that part.
Yeah, and you mentioned, Yext and some of those tools like that. What they can also, and this was kind of top of my mind, is thinking about finding a doctor. So those tools can also help feed information into like a doctor profile, for example. So, I mean, one of the bigger things when people are searching for a doctor, how easy is it for them to find a specific doctor? I mean, consumers typically search by condition versus type of specialist. So, if my knee hurts, I'm going to start looking for, knee pain doctor, as silly as that sounds. A lot of people might not know that like they need to see an orthopedist or, what that specialist is. So, I mean, thinking about your find a doctor on your website is such an important tool. Making it so easy for someone to come in and type a condition without having to know what their specialty is, or where they graduated from, or what their are they a DO, are they a what their specific credentials are, is so much less important than them being able to type what hurts and seeing a list of doctors that they know is going to be able to help them. So I think another pitfall, talking about the previous question about, specific pitfalls, is having a doctor search that's maybe makes sense to the people that work at the hospital and to doctors, but does it make sense to a patient? Is that how a patient's really searching? And the answer is usually no. I mean, even as myself, who's pretty involved in the healthcare industry, I'm not going to know the name of every type of specialist out there. So it's so important to have that data mapping. I mean, I think you can still have all that information and allow someone to search on that if they know it. But, I think in addition, you also need to have a way for them to search based on what's ailing them. I mean, and you were talking about locations earlier. Another way that, most patients are searching is what is closest to them, what is most convenient. And so you want your Find a Doctor tool on your site to also be able to click a button that's, closest to me, or filter or sort them rather that way, so that they're not picking a doctor that looks cool on paper, but is, a lot further than just as good of a doctor that's right next door. I mean, and this also, my mind's just going.
I
You
love
know,
it. Keep going.
I mean, just thinking about search in general. I mean, also thinking about your website's, global search, the search in general. This also goes with the Find a Doctor search. Does it account for misspellings? I mean, there's so many medical conditions out there that are really hard to spell. So is it going to account for phonetic searching and errors and provide real-time suggestions? So type ahead, like on Google, when you start to type to search something, you're seeing, potential things that you can click on without typing out your entire phrase. So we've built so many websites before that are making sure that we're accounting for misspellings, phonetic mistakes, showing those suggestions. So if someone doesn't exactly know how to spell diabetes or something like that, if they are typing D, it's going to be already returning a list to them of potential conditions that start with D. And I mean, I think that's just huge, because I've watched so many user recordings of people on Hotjar and tools like that, where people, if they don't know like how to spell something or exactly what to type, then they're getting no results, and then they're going to quit. They're going to go elsewhere if they're getting frustrated, if we're not accounting for, basically a Google level search. So I mean, that is super important. Um,
Well, and that's exactly what we're talking about, right? The patient experience.
yeah,
How easy is it for me to find what I need on your health system's website, even if I am not sure what my knee pain, the example you used is, or how to spell a condition that I think I might have, right? That's what we're trying to get to. We're trying to make it so simple for someone to find the care that they need, right? That's kind in a lot of ways, that's considerate in a lot of ways, and it's also helpful in a lot of ways, right? I mean, that's kind of the point that you guys are both communicating here, if I'm understanding that correctly.
Yeah, 100%. And I know I think this original question was like a lot about tools and things like that, which I might have kind of gone off a little bit, but um as I'm still thinking about Find a Doctor, the other piece of that is having a credentialing system, um, which maybe we touch on later. I'm not sure, but it's so important, I think, to have a credentialing system, especially if you're a larger health institution. You have a lot of doctors. That's a lot of information. A doctor leaves, a doctor retires. Who's in charge of taking down that information so that people aren't trying to make an appointment with this doctor. All of that stuff that's in your credentialing system is kind of like Garrett was talking about earlier with Yext and things like that. It's like your one source of truth. You don't want to be updating it every which way. But yeah, again, I don't know if we talk about credentialing systems later, but huge fan.
Yeah. Oh, yeah. I mean, I know you and I have had lots of conversations, in various different settings about credentialing systems. And yeah, I'm glad you brought it up. We'll definitely, I think there's more opportunities to talk about it later. Of course, throw things in there anytime they're relevant. Gary, did you want to close with anything specifically on like recommendations or tools that we are recommending to healthcare systems to help improve that access to care and patient engagement?
Yeah, absolutely. I think Caroline nailed it on the head, kind of back to what I mentioned earlier, one source of truth, being able to provide automation, update it in one system and have that cascade. I think the other important consideration is kind of the complexity of the layers that exist between a public facing website and the EMR tool, whatever that is. A lot of hospital organizations across the country utilize, we've got Epic houses and Cerner houses and some other smaller tools out there. Those two are the predominant, but the integration from your public facing kind of non-protected information to the avenue to get into what I would consider the portal, into the patient care access that lives within the EMR, it goes back to that access of care, for the patient to be able to not only go to a public facing website, schedule their appointment, but post appointment, they need to see lab results. They need to see prescription renewals. A lot of times they're communicating directly with their healthcare providers on those lab results, test results, any questions that may come up after the fact. So the integration between the public facing website and that back end electronic medical record system is really key and, an important aspect in healthcare these days.
Yeah. Um, this is super helpful. I think we could probably talk about this question for maybe another 3 hours, potentially. In the interest of we're probably gonna have to have a part two on this, but in the interest of continuing today's conversation, I want to kind of shift gears a little bit. And we've talked about solutions, we've talked about things that we recommend, we've talked about keeping the patient first. You guys have both done this for a long time, and I'm sure there are some hurdles, there are some roadblocks, there are some challenges that our customers, the people who are responsible for the website or the digital application that we're building, that those folks run into on a regular basis. Maybe we can address some of those things and talk about how we can help folks overcome some of those challenges or pain points or roadblocks or whatever you want to call them, because all of these things that we're recommending are so valuable. But I know, just having talked to you guys before, there are sometimes those things that are difficult to overcome to actually implement them.
Yeah, for sure. Um, I would say one of the biggest hurdles that I've seen, well, this is typically with a larger health system, but I think it probably applies to smaller health systems as well. But there are a lot of different stakeholders involved. You have doctors, you have heads of department, you have so many kind of opinions. And in certain situations that I found, one department thinks that maybe they are more important than the other department, and deserve special recognition on the homepage or a special treatment to their page. So I think one of the hardest things is making sure that you're hearing all of the voices, but and you're making them all feel special in their own ways. Like I can think of one scenario where we had a hospital and they had probably 6 or 7 different like main departments. They had a ton of other departments, huge hospital system, but like their core centers of excellence, So we went on site and we met with every single one of them, heard what each one of them needed and valued the most. And then we designed around that. So everyone felt special. Each one had their own little flavor to their landing page of their department. So making all of these disparate groups cohesive, but also feel special at the same time because, you don't, they're doing amazing work. You don't want to discount them or anything, but that I've seen certainly cause a butting of heads of sorts to be figured out. Garrett.
Yeah, yeah. I was thinking of a kind of a similar scenario. You think about the different departments in some of these larger healthcare organizations, and there are a lot of personalities, a lot of initiatives, a lot of things going on, and from a website standpoint and from an audience standpoint, every one of these departments has kind of a unique audience. If we're dealing with a trauma center, that's a vastly different audience group or patient group than a plastic surgery unit. So being able to tailor kind of their corner of the website to the patient experience that they're looking to have, the type of information that they need to get in front of their patient group is key. I think the other thing that you kind of touched on early was the number of stakeholders that can be, in these discussions. I think kind of one side effect of the size of some of these organizations can be the siloing across departments. And it's no fault of the organization or the leadership. It's just kind of the nature of the beast, if you will. And every department kind of runs its own entity within the larger organization. And a lot of them have their own projects, their own business goals, their own initiatives. And they're so focused and in the weeds on what their group is doing that a lot of times they don't understand kind of the global vision of the organization as a whole and kind of all the different nuances that go across the number of service lines. So I think that's where having an agency that, with a lot of healthcare experience comes into play to be able to kind of navigate those waters. Because not only are we talking patient-facing groups with the service lines, be it orthopedic, trauma, oncology, that kind of thing, but also kind of the back end operational side, the information technology group, the human resources, marketing. There's a multitude of different departments that all have to come together and kind of come into alignment when we look at how to strategize and build a website that's going to serve the needs of the entire organization from top to bottom. I think the other thing that comes into that, I think another hurdle is a budgetary one. A lot of healthcare organizations, budgets are tight, with any organization out there, not only healthcare, but considerations given to their budget process when their fiscal year start and stop. A lot of organizations run on a calendar year fiscal year as opposed to a July 1 to June 30th fiscal year. And, a lot of agencies, offer flexibility around that and kind of tailor that to the project. I know we've had that with a number of our clients here at Unleashed where, maybe we're in March and they're a July 1 to June 30th. We're in that last quarter of their fiscal year and we're looking at a large, website redesign or a web build and being able to kind of understand their needs, understand their budgetary requirements, and being able to kind of have some flexibility and work with them on that. I know we've taken kind of a phased approach. If you're looking at a complete website build, maybe we break it down into 3 or 4 phases to kind of help, not necessarily eliminate, but ease that burden that the budget and their fiscal year kind of bring into that conversation. And that can go a long ways to kind of make it a little bit more palatable for the organization as a whole.
Yeah, I love it. I think you guys have covered a lot of really, kind of critical factors here on what these hurdles might be. And Caroline, I know there's another one here. I might have jumped in right before you were going to continue talking about credentialing systems. I know that's one that you love internally to go on. about, and it's kind of, maybe, I don't know, maybe it's a passion project for you. I think maybe there's something there. But I know, you mentioned that a little bit earlier, and making sure that that integrates with the EMR as well. Um, and I know that's a big, potentially a big hurdle, because there's lots of stakeholders involved in that too. Would that be accurate?
Yeah, yeah. It takes a village to have clean data going into your credentialing system. I mean, many health systems that I've done work for, they have to have a person that can sometimes be their entire job is, okay, so and so is retiring, or so and so got this certification, and this new doctor's coming on, and it's a constant stream depending on how big your system is. But I think I'm such a big fan of them because I've seen hospitals that have come to us that don't have one, and they are fed up with having to log into their CMS and manage, like, oh, the phone number changed. Okay, I have to change this now on 15 different doctors' profiles. Oh, does this person work there anymore? I don't know. So having, just a feed that can run into the site, you have to update it in one place. So if a location's phone number changed, you update the location phone number, and then you're done. So I think the joy I get from seeing um different health systems where they didn't have a credentialing system, and like the weight off their shoulders once that they do, I think is why I just think it's so important to bring up,
Yeah.
and for health systems to consider.
Yeah, I love it. So, hurdles, if I'm going to recap here, right? Lots of stakeholders, lots of competing goals. Sometimes some silos that get in the way. You're bringing in a lot of different tools and and platforms that need to be integrated. Clean data is a struggle. There's a lot of things these healthcare systems are dealing with on a daily basis. And Garrett, I think you said it really well. Like, that's why you need somebody who actually, understands the healthcare experience, both on the provider side and on the agency side, to be able to help kind of manage and wrangle all of that alongside you, kind of taking that partnership position. I'm glad that you brought that up. I think that's extremely valuable. Um, I'm
Yeah,
gonna,
you know, not to cut you off, but we talked about a lot of hurdles, but we also didn't mention any of the regulatory hurdles that come into play in healthcare. So kind of as you were alluding to, having a partner that understands the healthcare regulatory side of things. Whether it's pricing transparency, HIPAA compliance, data retention, that kind of thing. That's just one more layer of the puzzle here.
yeah, for sure. Well, I'm going to completely shift gears in this conversation and completely make all of our viewers and us go like, "What the heck? Why did he just change the direction of the conversation?" So bear with me on this. But this is something that we as an organization at Unleashed find to be very, very important. It's a question we ask on every single one of our podcasts, and that is, how does the work that we do impact underserved populations? And so, in this particular instance, I would love to get your guys' opinion on how, when a healthcare system embraces these improved digital technologies, how does that help serve underserved populations in their own communities?
Yeah, great question. The first one that comes to mind is kind of what happened after COVID. I mean, we saw with COVID where people weren't able to go into a doctor's office or whatever it was, that video visits and they skyrocketed as, an option for people who weren't able to make it into a physical office. And with the video visits that are now out there, I mean, if someone lives in a rural area or they don't have the means of transportation to get to a doctor's office, I mean, this is a great option that it pretty much since COVID has really gained a ton of traction. I mean, you can get your prescriptions, you can talk to your therapist, you can talk to, whoever you need. Obviously, if there is a more serious condition at hand, video visits would not be applicable. But I think that's just huge for, again, people that might not have the easiest way to get to a nearby office. Um, I think that's something that comes to mind. I'll think about it a little bit more with Garrett. Do you have anything come to your mind?
Yeah, I think my mind's always on data and analytics. So I think when we think about underserved populations, is there something that the data that we already possess in our organization, is there some way that we can slice and dice that and kind of find those trends, find those opportunities to better serve some of these groups that do fall in that category. I know in healthcare, it's easy to think about that, very pointedly. But a lot of times the underserved populations, it's not necessarily about providing the healthcare, but it's connecting them with different community resources. That may be within your healthcare organization, but it may very well be at the county or the state level. Some of the outreach programs that the different government entities offer, and being able to be kind of that middleman and make that connection between this underserved group and those resources, that could be, a number of different opportunities. But that's kind of where my mind goes, is on that data and analytics side.
Yeah, I think it makes total sense. I mean, are there any trends that you probably already have data to back up that you just haven't identified it yet? How clean is the data? How well is it organized? Actually had an opportunity in the past to work on a campaign about the COVID vaccine. A nonprofit organization who was trying to communicate with the Spanish-speaking population, potentially more underserved version of the Spanish-speaking population in their local community, and there were campaigns that we built and ads that we created to communicate with the value of the vaccine and where they could get it and who they could talk to and all those types of things. So, both of those things, I think, to your both of you guys' points, it's really like we've been talking about since the beginning, is can we get these individuals access to care when they need it, where they need it, especially video visits. I think that was a great thing to bring up, Caroline. Like, if you don't have transportation, or you can't get off of work, or whatever it is, like, you need to be able to still see a doctor. You still need to be able to get care. And those video visits are a great way of doing that. And then using the data and analytics to serve and educate the community is a great way for us to help hospitals serve those underserved populations around them in their hometowns. Anything else you want to add, Caroline? I know you said maybe you think about it and maybe something else would come to mind, but I think those are two really good answers.
Yeah, maybe it'll come soon. A lot of questions. My brain is like,
That's all good. That's what this is about. Well, let me move into our final question here. I know we try to keep these podcasts to a certain length of time, but we've talked a lot about data. We've talked a lot about people needing care in a specific way, but we haven't talked about kind of like the big elephant in the room for a lot of organizations right now, and that's artificial intelligence. It's a potential asset for every company. And we've talked about it a little bit here at Unleashed, but I want to talk with you guys, like, get your opinions on what do healthcare systems need to think about today if they want to be able to take advantage of AI in the near future.
yeah, that's a great question. Um, One thing that comes to mind would be like symptom checkers and chats that we've created. So it's tricky in healthcare, right? With AI, it's probably being the most slowly adapted because you're playing with people's lives. There's a lot more at stake with the potential errors that AI could make versus like, if we're just doing a brochure website or something very cut and dry.
Sure, yeah.
Um, so what comes to mind would be potentially a symptom checker that we've created before where, you're filling in, okay, you've probably done one before where, what hurts, click the area of the body that hurts and then it'll be like, okay, it'll take you to your next step. And then you'll go through these series of questions and it'll eventually, give you a list of possible things that could be going on that probably scare the heck out of you.
Right.
Uh, or I mean, that's kind of like the extreme, like
Right.
WebMD version.
Yeah.
But hospitals that we've done it for, a more simpler version of that is, should you go to the ER? Should you call your doctor, or should you go to urgent care? So after filling out your list of symptoms, it's going to guide you to, okay, yeah, this is an emergency. Go to the ER. Here are the closest ERs to you, and here are their wait times. Or it's going to say, okay, you don't need to go to the ER, but you should probably go get that checked out today. Here are your closest urgent care spots, and here are their wait times. Or, hey, I mean, you don't have to go anywhere today. These are a list of possible doctors that you could make an appointment with that can help you out with this, in the coming weeks or whatever. So that's one way. I mean, a lot of data has to go into that. Again, I mean, all of this is so data driven where each hospital, I mean, we can rely on things like Chat GPT or things like that for this, but you really don't want to rely too hard just yet. So you really need another layer on top of that, that is data that's kind of curated or mapped out by the healthcare organization that says, okay, if they select this symptom, then next up, show this. So, you know, AI in a sense, I think we'll get there. But again, like, I think healthcare will be one of the slower ones just for legality and uh, the matter at hand.
Yeah, for sure.
Yeah, I think you hit the nail on the head there. I think there's certain areas of healthcare that AI could definitely, be utilized and is being utilized for right now. But I think some of those deeper nuances that get into, as you said, affecting patient lives, not only the compliance side of things, but getting back to kind of preparing data for AI in the future. You talked earlier, Caroline, about having clean data, having it structured in a way that can be consumed by an AI tool. I think on the backside, what that means from a technical standpoint is really integration. It's integration across both the patient-facing side of the business as well as the operational side. I kind of touched on that earlier. When we talk about AI and data, integrating it across IT, HR, marketing, out of the EMR tool, and having all of that data in there. And then from a usefulness standpoint, for an AI tool to be able to utilize that data, it has to be structured in a way that it is logical. And then you get into things like adding value to certain subsets of data or certain fields of data. And I think that's where, some of the lag in the healthcare industry may come from, just because there is so much data to process, so many different aspects in there, and being able to assign value to that data so the AI tool then knows what to give the most relevancy to. In your scenario, maybe it is a really robust symptom checker. The patient's going to put in their pain points or what their issue is, and it's going to need to know, based on the symptoms entered by the patient, which data to put more weight in to generate that response, and know that we're going to direct them to the right level of care. I think that's a huge aspect in healthcare, is that right level of care. We don't want to send somebody with, a superficial scratch on their finger to the ER, because that's just going to impact wait time. It's going to impact lag in providing care to those that actually need that level of care, as opposed to, a primary care physician, where they can schedule an appointment a week out for whatever that condition or whatever ailment they have. And it gets them to the right level of care, not only saves the organization money and creates efficiencies in them being able to provide the right level of care, but it's also going to save the patient money in the long run with their copays and insurance deductibles and those kind of things as well. I think going back, and you kind of touched on it earlier, Dustin, when we were talking about, you mentioned COVID and, kind of this idea of having to provide, outreach to, non-English speaking groups. I think that's an area where AI can have an immediate impact for the healthcare industry. There's, a lot of tools that can be utilized now to take, a first English, curated content website and, make it bilingual. Do utilize an AI for language translation. I know during COVID, at the organization I worked with, we relied heavily on our language services department to manually have to, translate all of our COVID documentation and instructions and information into a multitude, over a dozen different languages, whereas AI could, do that very repetitively and, very quickly, with really no interaction with another department, no need to call on, additional personnel for that effort. Other things that come to mind with AI on the website is content personalization. It kind of goes back to that user experience that a patient has with the website. If they're always coming to the website to, interact with primary care physician and go into the portal and interact with their healthcare providers that they've seen before, AI could be utilized for content personalization to learn from their past visits to your website what the content that they're interacting with, and kind of serve up a custom experience for them based on previous trend data. That way they're not poking through a 500-page website trying to find the information that's relevant for them at that time. um,
Yeah, I think there's definitely some, like, you have to be careful, right, in healthcare with AI and like serving certain types of content, right? You don't want necessarily someone to go in and like search for this rash on my arm and then the website saying, "Hey, what's going on with that rash on your arm?" Right? Like, there's a certain level of obviously HIPAA compliance and all that that we have to keep an eye on. But I think to your point, if we know that the user is going in to connect quickly to their my chart, for example, why couldn't the website make it easier for them to go ahead and take that step that they want to take anyway, right?
yeah, absolutely. And I think kind of going back to location management and kind of provider listings as well, one other aspect that just came to mind would be using AI for, feedback and reviews that healthcare organizations get. That's a huge aspect of the digital space nowadays. And, a lot of companies are out there soliciting, feedback. They want to hear from their customers. They want to hear from the patients on their experience with a certain location, with a certain provider, and being able to quickly analyze that feedback is an area that AI could definitely help with as well. Using sentiment analysis to be able to look at keywords, pull out keywords from a review that's left for, say, a location. Maybe the wait times were extremely high. Maybe the lobby was dirty. Things like that. AI can kind of ingest those reviews, be able to pick out the salient pieces of information that the organization needs to know, and it allows them to more efficiently and promptly address those concerns, not only with the patient themselves to kind of have a corrective action or a discussion with the patient, but then to be able to go into that facility, for instance, and correct that actual issue that caused the poor review to begin with.
Yeah, I think that makes total sense. Um, wow. Okay. Well, we've covered a lot of ground today. We've covered a lot of information that you guys have just been a wealth of knowledge. Is there anything that we didn't touch on today that you think you'd like to add here as we seek to provide this value to our healthcare companies or healthcare companies that work with us? Is there anything else? Is there anything that we missed? Is there anything you want to say differently?
I think I'll jump in there. I think the main thing I would kind of recommend to healthcare organizations is don't be afraid to ask questions. If you're looking for a partner in creating a website, creating an application, helping come alongside your organization to help you in the digital space, ask questions. Find a partner that is in alignment with your business goals, understands the hurdles that we discussed earlier. Obviously, there are plenty. Understands kind of that regulatory and compliance side of your business, and ultimately, finding a partner that's going to provide, a value based benefit to your business and not going to just become an additional hurdle, financially or time wise to your organization. It's really going to help move your organization forward.
Love it.
Yeah, you said it.
All right, you said it. Caroline, Garrett, thanks so much for joining us today. This episode, I think, is one that we will use a lot that I think is going to be very, very valuable. Again, the title, How to Improve the Patient Experience Using Your Healthcare System's Website. These two shared tons of information that's highly valuable today. As always, if you have questions or you want to have further conversations with us, reach out to us online, unleashed-technologies.com. Find us on LinkedIn. We're happy to connect with you there as well. And as always, until next time, keep that technology unleashed.